Welcome, everyone, and thank you for taking time out of your busy day to join us. My name is Laura Clemens, and I'm with Greystone.net and the moderator of this webinar. To ask a question, please submit through the question pane in the control panel on the right side of your screen. And due to the size of attendance, attendees will be in listen-only mode to cut down on background noises. There'll also be a short survey at the end of this webinar, and we'd really appreciate your feedback. Now, I'd like to welcome our presenters today. Satya, Milestone, Inc. Eric, Vice President of Marketing at Milestone, Digital Marketing Manager for Flake Dermatology and Cosmetic Surgery. Satya is CTO and brings over 17 years of experience in product management and strategy, new product launches, and ownership to Milestone. He has an exceptional record of in defining delivery and growing enterprise software products and startups and mid-tier companies. Satya has displayed strong business ownership by bringing global teams to deliver strong product results, and has mentored and managed global product management and engineering teams in the US, Asia, and Europe. Eric is the Vice President of Marketing at Milestone. He is the growth marketing executive who takes full life cycle view of customer acquisition, experience, and retention. Prior to Milestone, he was the Vice President of Growth Marketing at BrightEdge. Early on in his career, he spent 6 years in Japan and earned his MBA there, and then started his career at Dentsu Agency in Tokyo. Eric has worked in tech marketing for more than 20 years at Adobe, MP3.com, Netflix, and TiVo. He has published more than 150 blogs on SEO, is an accomplished speaker, and wrote a book called Hack the Corporate Fast Track. Adam currently serves as the Digital Marketing Manager for Austin, Texas-based Westlake Dermatology and Cosmetic Surgery, the leading provider of medical dermatology, plastic surgery, and medical spa treatments in Texas. In his role, Adam oversees all things digital, including SEO, content strategy, CRO, social media, and pay per click. In his time at Westlake, he helped transform the site into one of the most trafficked in the space, increasing total traffic by over 540% since joining the company in 2013. Now I'd like to welcome all over, and we'll turn the webinar over to Eric and begin this afternoon's presentation.
All right, so the content we're going to cover today derives from and that is the crisis recovery and growth framework that we developed in early March. We have hundreds of customers and all kinds of businesses, and they were looking to us for advice on what do we do? We're going to close, we're going to have limited, we're changing our services. Things were happening so fast that they sometimes needed to update more than once per day on what was happening across 100 or 1,000 different branches in their network. So we created the kind of crisis response week or two. And then we pretty quickly realized that the crisis was the beginning, and then people were really, after they settled in, they were going to need to focus on what is recovery, what is shelter in place, and then what is later recovery and growth look like, and how do we take advantage of that? Because you don't want to be a deer in the headlights. You don't want to be frozen by the crisis. You want to keep taking action and making good plans. So we developed a whole webinar series, and we focused on the SEO after COVID. When we spoke with the Search Engine Journal, we did some technical topics there on FAQ, schema, and AMP, which we'll touch on here today. And we've put a COVID context into it, because obviously as an essential, the most essential industry fighting the crisis, you guys have had to deal with a lot during the crisis and now into the recovery phase. And then later we are going to do, next week we're going to do a webinar on content and focus on some B2B. So please, if you're interested in any of these other topics, or if you have colleagues that are, you can catch the on-demand at the links, and we're going to send you the deck, and we are recording, and we'll make the recording and materials available to you within 48 hours after the event. All right, the first thing I'd like to do, or the next thing I'd like to do, is to make sure I understand your context and what is most of interest. Satya and Adam and I will use that information to be more relevant as we make comments and throughout the rest of the webinar. So Laura, if you could launch the survey for us.
Okay. There we go.
So if you guys could just click in a little bit of feedback for us and let us know what's most of interest, we'll be as on target as we can be for the rest of the webinar.
All right, a couple more seconds and then I'm going to close it. Okay.
All right, can I blow this up a little bit bigger? Let me see. Laura, can you read out the results to me?
Yes, poll results. Providing COVID information to the community is 26%. Managing COVID-infected patients is 2%. Acquiring new patients after COVID settles, 64%. Managing appointments, timing no-shows, 8%.
Okay, great. So that's great. All right, next here's the agenda for today. I'm going to describe the CRG framework and the 3 phases and how we broke it out and how we across those activities. And I'm going to show you some healthcare marketing data that I think you're going to find pretty interesting and compelling. And then Satya and Adam are going to go into local tactics, GM, and key steps and tactics and takeaways. And I have some research to share with you that has never been published before. I actually made a benchmark of the registrants of the webinar. I took your websites and analyzed them, and I created a benchmark to share with you to show you kind of how everybody in the webinar is performing on those. All right, so this is the CRG framework, and as marketers, we are going to be dealing with most channels in most weeks, in most months as we do things. The Excel required our focus on particular channels. So the website was the best vehicle for communicating information efficiently and people who are coming to see what was going on and what was available. And then SEO, it was also absolutely fundamental in communicating, particularly local hours, maps that are changing, location information, access to services and so forth. And Satya and Adam have a lot of great examples on that, and local and content. So the tactics within those channels were like the command was the goal was to maintain and increase the digital relevance, and then get into some specific COVID response content. And then by the end of that phase, you're developing new content for maybe treatment, diagnosis, and care. It looks like not so many of the people on the call are as focused on treatment. Now, as you get a couple weeks into the COVID crisis, we are recommending that you retool your website and you prioritize some of those projects that haven't been in the top 3 before. Page loads, FAQs, and generally the site performance. And in this phase, we recommend thinking about appropriate service offerings and product offerings and putting those offers in market and learning about the customer reactions to that information and whether or not and whether or not they're meeting the customer's needs. And during this phase, you've probably ramped down, in the crisis phase, you've probably ramped down paid, and now you're ramping up content, and you're ramping up your site performance and your site experience. Now, as you come into the growth phase, which is maybe going to be June, around, maybe about 5, 6 weeks, 7 weeks from now, that things will get more back to normal. You want to harvest the content marketing efforts. You want to scale paid media back up and leverage different tactics in paid, and then potentially prepare for new shelter in place or things to change. We want everybody to be ready with their contingencies as they go forward through these phases and back to the normal phase. All right, so here's the customer journey. On the bottom is the kind of a typical marketer's journey: awareness and engagement and recovery. And we kind of adjusted that so that we have pre-diagnosis, diagnosis, and treatment and follow-up as the things that people are going to be focused on in your industry. So this information is really interesting to me. This is from Google's The Digital Journey to Wellness and the Hospital Selection. So if you're interested in reading more about it, you can search for it there under that name. But Google's point was that 77% of people use search engines in that patient journey, and that makes it far and away the largest channel, the most influential channel, the most involved channel. No matter what route, the overall route people are taking, that search is highly involved. And that of the people who booked online, 54% of the people who booked online are new patients. So there's an opportunity there. 94% of people in the survey said that the reputation of the facility is important. And this data is a little bit old, so this is reputation in the traditional sense, the prestige, the history of it. But ultimately, reputation means marketing, and it means if we do good work, if we have interesting transplants or breakthroughs in treatment and care, that marketing has always been important, but it's even more important. And there's a component of marketing that specifically became more important over the last couple of years, and that is reviews and reputation. What other people are, doctors, greatly influences people's decisions on whether they want to do business with a particular provider. So here's a couple more pieces of data from that study that they look at the provider site, they get information from the health insurance company site, who's in their coverage plan, health information sites and rating sites, and then consumer generated reviews influence people this way. So I've seen data more recently that 60% of people have chosen a particular provider facility because of the good reviews, and an equal number, 6, to do business or not to get care from a provider that had poor reviews. So super important, and Satya and into how you manage a number of these. So though all the online information is critical, 88% of scheduled by phone. So I talked to Adam about this as we were preparing. He said, yeah, that's true for us, particularly with the new customers, that they are they want to establish a relationship not digitally, and they want to use the telephone to call the office. So driving calls drives growth, and local SEO drives calls. So I'm going to go through a couple of steps here as we lead into how to do these things on a step-by-step basis. Your website is what Google is reading. It's what populates most of Google My Business. So they're two separate ways to distribute information, but in combination, they're going to create 50 or 60% of everything somebody's going to see when they're looking in a branded search, or when you're showing up in local searches for the kind of services you provide. So this is the research data that I collected for you, and it'll become more clear why I focused on these components. So schema is a way of adding information for Google that makes it easier for it to understand the context and the details, and for it to lay it out and distribute it via the knowledge base and via the search results pages. So 54% of the sites in today's registrar out there in the audience have no schema. And that's a missed opportunity. Only 18% of the sample uses more than 8 schema. And the medical industry is kind of uniquely positioned to take advantage of many, many, many different schema types and information types out of the 818 that have been defined by Google and schema.org. Now, unfortunately, 60% of the sites in the sample that are using schema are also showing errors, and the errors can damage, like an error make 35% of the impressions appear overnight, and when you fix it, it comes back. But it's important to monitor those, and I can share that information. I can share the reports that I created with you if you want to sign up to see more details. The sites with schema averaged 2.4 times more pages indexed in Google, and the average mobile page speed score of the audience was 39, with a range from 8 to 96. And kind of surprisingly, 96% of the sample are not using AMP. AMP is accelerated mobile pages, and the accelerated mobile pages are a markup language. It creates a sort of a subversion of the site that makes it easier for Google to display in the search results page, and generally accelerates the page and enhances the user experience. So this industry there's a lot of mobile use and a lot of mobile applications. And so this is definitely an opportunity to improve. And I'm going to pass over to Satya and Adam. They're going to go into some of the more details on these tactics.
Hey guys. Hey Adam.
Hey there.
Hey. Let's see. All right. So Adam and I, we've been talking about this, and at Milestone, we've been working on helping several other industries, and we realized a lot of the stuff that we discussed are applicable to healthcare as well, and that is kind of the culmination of what we are doing with Adam and with Greystone. Because Adam has a lot of experience, has done some of these things that we talk about here, as well as we have some more best practices that we can share on top of what Adam and I be discussing. The first and foremost thing is to get this mouse working. Is business transformation. As we talk to a whole lot of industry, hospitality, banking, and healthcare, every single business is actually transforming in itself as people are finding different ways to reach out. The first and foremost thing, as you guys have noticed, the lab testing has moved to curbside because they don't want the patients to come inside the hospital. And if you guys look at the Google Trends, there is a huge drop in searches for hospitals near me, or basically there is a drop in people going to hospitals. And in fact, the Washington Post article from April 19th this weekend actually talks about this, where they say that there is actually declining patients in hospitals for even the regular heart attack, strokes, and appendicitis treatment, because people are now scared to get to your hospital. And this means hospitals and healthcare systems need to pivot into newer models and newer approaches to reach to their patients. And telemedicine and telehealth has been one of the things that have been touted as next thing in how healthcare is going to attract. Adam, what is your experience of this?
Yeah, so we, as the outbreak started, we pivoted pretty quickly to strictly doing telehealth, so doing teledermatology appointments. And ironically, we actually experimented with it about a year or two ago, and it really didn't work very well. Our providers didn't like it 2 years ago, and we didn't really have a lot of requests for it. So we sunsetted away. But that was kind of a blessing in disguise, because we had some experimentation behind us with it. So when we had to get back into it, we kind of knew what we wanted to do. And it's been pretty popular. Obviously, we were unable to see people in person. So it was really the only thing we could offer. We didn't have a choice. So we transformed the website. We disallowed booking of any other appointment other than telehealth. We put it all over the homepage and every single page. It was on all of our individual doctor pages that you can see them through telehealth. We did email, we did social media, we'll talk about Google My Business, but on all of our GMB profiles, we did posts. We, redid our URL to, instead of going to our normal booking, to go to telehealth. We were like, come and see us, telehealth. So it's been really good. There's definitely for us, there was definitely some learning to do. In particular, on the provider side, obviously they were used to seeing people in person for so many years. And some of our best doctors are not exactly the most technical. But it's been a lot of fun. I've been working with them to get them more involved. And Anuj, who is our CTO, God, he's probably been up, he's probably done a lot of 18-hour days, as you probably know, Satya. He's done, if you're watching Anuj, thanks for that. And yeah, so it's you're gonna have to do it. Other derms and other cosmetic surgery places are gonna have to do it, obviously. And by the way, interestingly enough, we're in Austin, Texas, and last week our governor decided to reopen the economy. So starting next week, we're going to be taking live people in our offices. So we're actually in the recovery mode right now, where we are transitioning back the website to having people sign up for in-person appointments. And after this call, I just wrote down, I was like, oh no, I got to go back on GMB and put that up, that they can come and see us now. So it's a great reminder.
Right.
Yeah.
So following up from Adam's comment, that is quite a bit of learning there, as hospitals are pivoting into some of these. Did I go? No. Sorry. Okay, as hospitals and healthcare systems are pivoting, we built a framework with which we want to basically share to healthcare systems, as well as anybody working in auxiliary healthcare, to basically think about what you do when you are in crisis mode, what you do in terms of when you're in recovery mode, and what you do in terms of growth mode. And again, this is just our own learnings. There are no hard and fast rules here. As a marketer, one of the big things that you are going to do is you're going to experiment with a variety of things and identify what are the things that work with your community, with your patients, and figure out the best solution. Some of our recommendations are basically in crisis mode, basically define your schemas on the website. Make sure your website has the right messaging. As Adam pointed out, messaging on your website is going to be critical. Marketing is, again, I'll talk about briefly about email marketing, messaging your community, your patients about actually. Look, talked about GMB. There are key channels that you do want to make sure that you update your patients about what changes are happening and what attributes. We will talk about some of the attributes that you need to communicate. Social channels, again, social is another channel where we are seeing increased engagement, and paid is another channel where there is awareness messaging is definitely critical, but at this point in time, conversion, CPCs are low, conversion is fairly okay, but more organic channel is where we recommend, at least at this point. But what is right for you is something that you find out. As Adam pointed out, as they're moving into recovery mode, patient nourishment, you need to nourish and re-engage with the patients that have stopped talking to you because of the whole care. Focus on targeting, consideration. Again, go back to updating information on local is going to be critical. Updating attributes on local is going to be critical, because that's one of the places that they're going to look for. And of course, as recovery phase begins, some specific targeting, email marketing will be helpful to tell them that you are coming back to normal. And of course, hyper-local targeting on Google and social media always helps, right? Now, taking into exact next steps, right? So what are all the things that we look for? First and foremost thing, if you look at Google My Business, there are specific items Google My Business has opened up, wherein you can go ahead and start updating the information as to whether you're open, you're closed because of a certain activity, Is your emergency room open? Is there any specific instructions that you want to give your visitors regarding COVID-19? Is that linked to your website that you want to take them to? Is there anything about events or anything that is happening within your hospital that you need to make sure that you communicate? Adam mentioned Google Posts, and Google Posts is another have very high visibility, and we strongly recommend some of this. Adam, what is your take on Google My Business and knowledge panels and updating information there?
Yeah, first off, Google My Business itself is pretty invaluable. I would say about a year and a half ago, we've always done Google My Business. We've always, obviously, I think everybody should invest in it. It's something that appears in the local pack on Google, but we really didn't put too much effort into it. And about a year and a half ago, we actually tagged our URLs with parameters. So that way in analytics, it would be segmented better than just organic. It would be local. And it was surprising. It's definitely, the conversion rates are really high from people who come from Google My Business into the website. And as soon as we saw that and I presented it to the board, we started to put a lot more effort into it. We're doing posts. We're trying to do Google Posts 4 to 6 times a month. We're updating pictures. We're really paying attention to reviews. Where before we would kind of just let them go on their own. We're responding, and we're soliciting or asking for more reviews. And then, like you said, the posts are definitely valuable. You want to use Google My Business as a funnel to your regular site. So on every post that you do, you're going to want to include a CTA. We do a lot of teasers where it's almost a lead into a blog post that we have. So the post is the first paragraph or two to get them excited, and then it's click here to view more information to get back to our website. So that's kind of how I look at it. It's an opportunity. Google My Business is an opportunity to get in front of people, but it's also an opportunity to use as a funnel to get back to your main site. And that's kind of how we treat it. All right.
And again, most critical is that if you do not control your local listing or knowledge panel, one of the bad habits that happens is that Google will crowdsource information from users, which is something that you want to prevent. You would rather have you control the source of truth that appears in Google My Business, especially during these critical times. Misinformation about your business and your healthcare system is going to be very preventing that, and making sure you control this is going to be very critical. Right?
That's a good point. Yeah, I didn't even mention the question and answer section in GMB, which is an area where anybody can ask a question, but also anybody can answer it, and it appears on your GMB profile. So yeah, check that out, guys. If you've never seen your question and answer section, there may be some interesting questions, and there may be some questions that you don't want on there, and some answers that are inaccurate on your behalf. So get in there and do that today.
And patient behavior in this crisis phase, I think Eric touched on this, Adam also touched on this. They are searching more, they are spending more time online, they're forced to spend more time online in front of their computers. Visits to the sites have increased, but request directions has declined and the call volumes have increased, which means you need to start planning for how you're going to address the call volume, as well as make sure that the customers who are visiting your website are getting the right set of information from your website. Searches are increasing, and visits to your sites are definitely increasing, and customers are seeking information. This is a data from Senior Care Center that basically had to adjust themselves to the increasing call volume during crisis. Right. Some of the key things, some of the key attributes, Adam touched upon some of the attributes. Google My Business has rolled up some of these attributes. I know Yelp also has done some of the attributes, call to actions, as a part of this. Facebook also has similar attributes. Now, they have actually, if you are pivoting, if you are a healthcare system that you're pivoting from basically meeting the patients face to face to more of a video visit, you can basically make sure to mark up this attribute. If you have a virtual care link where you want your patients to go in and sign up, add that. If you have a specific COVID-specific link wherein you want to share that information that are very specific to COVID-19, make sure to share that information. And all of that information pops up during searches. This is a sample how Kaiser has communicated their information. Sun City Senior Living basically updated their COVID-19 page with this, their Yelp page with this. And Adam has mentioned they have also updated their description. Adam, do you find value in updating the description, or do you think posts are good enough?
No, I think you got to do both. I think you want to do the description. It usually appears higher up, and it's usually more of a focal point. And you want to remember that you did it. Like I said, I have to go back and undo that now or adjust it. Just let them know that we are partially back. You can come and see us, or continue telehealth, which we would like. And then also you want to do the posts. Another thing I forgot to mention about the posts is for acquisition purposes. A lot of times, if you do a post and it contains a keyword you're trying to rank for, it'll actually help your profile appear in the local pack. And it's pretty instantaneous. You can do a post on, I don't know, Botox for us. And shortly thereafter, it'll appear better in the 3-pack. And in the snippet of the search result, or in the pack of the search result, you'll actually see part of the post with the keyword. So you'll know that it's coming directly from that post. So.
Brilliant. So again, definitely leverage the attributes, your description, product, services, and the status of your business. And if you're pivoting, make sure to mark up your Google. Now, as always, we are in one of the big problems with SEO is always the plethora of channels. I've marked up some of the key channels where some people are spending a lot of time. They are definitely spending time on Google My Business, of course. Facebook is another channel where you want to make sure your information gets updated. Yelp is another channel. Of course, Bing, because Yelp and Bing, because they power some of the other devices as well. Not just they power some of the search results, but they also power devices where people are talking to these devices. That does not mean you should stop investing in updating your information on some of the other sites like Yelp-Blaze or a WebMD. If that is relevant to you, or if you are managing it, make sure to have this information updated. As you are communicating more and more with your customers, Facebook Messenger, WhatsApp, or some of the social channels with which you can reach out to your customers, you can actually have more and more one-on-one conversations. If a chatbot is your preference, you can definitely use chatbots on your website, as well as integrate the chatbot with your Facebook messaging channels to reach out and start talking to your customers. Hey, how do you guys talk, Adam?
Yeah, we're doing Facebook Messenger. We've actually been doing a lot of Zoom stuff, which we built into the site, which is kind of neat as well. So those are our two pretty much main points. And then we have text. You can text us direct as well. Cool,
excellent. Getting into some more nitty-gritty detail. Adam talked about posts. Of course, posts are hugely valuable. You can see Adam's nice post on COVID-19 update. I'm sure he's going to go and do another post that is relevant for as they open up for business, relevant for their business. And of course, I have popped up additional Sun City Senior Living, how they are doing it. Such help, some of the information that they are providing, how they are coordinating with California and local health authorities to address some of these issues. Google My Business has a special COVID-19 post which you can leverage, and image is not needed. If it's just a plain update, definitely leverage the COVID-19 post and have the content ready and have a call to action ready with which you can link out to your website, right? Creating a landing. Sorry, I'm still there's a bit of a lag here. Creating a landing page with information is absolutely critical, and having all the information about COVID-19, about how you are handling this in this crisis stage, and how you plan, and also updating it with information on how you plan to handle it during recovery phase is going to be critical. Adam, what is your strategy? What are you guys going to do as you guys get into recovery phase?
Yeah, well, early on, before the shelter-at-home standards came out, we did have a COVID-19 landing page, and it was mostly on what steps we're taking in our offices, and also what we're expecting of patients as they come in. Then when it went to the full-on shelter-in-place, we're not able to see patients, that's when we flipped over to all telehealth, right? So it was mostly a landing page on it's a new offering, and really we found out some of the barriers to people converting for telehealth were questions about insurance, right? Because it's kind of new. So they're like, is this going to be covered under my plan? So we actually went and did a lot of research and made calls to our carriers, and actually had an area on the page that had major carrier and the rates so that we can massage those concerns. And now we're going to basically go back to almost normal. We're still going to have a telehealth blurb in the middle of the page because we still want to do telehealth, but we are going to try to start encouraging people to come in to our offices. I think we'll probably repurpose some of the content we did earlier about how our office is, how our sterilization processes, the need for everybody to wear masks. Our providers have to wear masks. All of our employees have to wear masks, and the patient has to wear a mask. There's going to be temperature checks outside. That sort of information has to be out there. Not only to let the patient or customer know that we take safety seriously and that they're safe coming in, but also so they can know what to expect. We don't want people to come and get turned away if they have a fever or if they don't have a mask or whatnot. So I think it's twofold. It's part letting your user patient know that you care and that you're taking steps to keep both them and us, the provider, safe, but also to give them some sort of expectation on how it's going to go, because it's all completely new. It's never been done, so it's going to be interesting to see how it goes. Like I said, our first week starts Monday. So right now we're in the process of filling out that first week of appointments. And I can say so far, it's gone pretty good. We actually are spending most of our time recontacting canceled appointments and just working with, our current base of patients and just getting those who needed to be seen in first. And then I think once we go through all that and get everybody in that needs to get in, then we'll start looking for new customers or going back to acquisition. So I guess going to the growth phase, right? So getting back into pay-per-click, getting back into other paid advertising, et cetera.
Okay, excellent. While you're updating the website information, one of the critical things that at least we love to talk about is schema. Marking up your website using some of the new schema opportunities. Google and schema.org, they have recently announced a category called Special Announcement Schema, where you can mark up your COVID-19 information page with a special announcement on what changes you are making, even if you're getting into growth into recovery phase. What type of changes are you making, and mark them up with special announcement actually makes it rank better. Here are some examples that we have used as a part of this. Making sure to optimizing some of the technical SEO time during this crisis by injecting schema or having schema on all your pages, as well as some of these special announcement pages, is going to go a long way in making sure that you are ready for some of the new things that is going to happen during recovery phase. I do want to touch upon one more item, which we are seeing a strong visibility. We talked about Google Q&A, but having some of these questions, things that your customers are asking, having these questions and having those Q&A on your website and marking them up with schema, FAQ+SCHEMA, we are seeing a huge surge in visibility, and we are seeing your increased higher search saturation with some of these results. We see a huge impression growth as well because of some of these FAQ schema. Even simply just dropping it in with marking up the content, we have seen a surge in some of the results that we are seeing. Hey, Adam, since we deployed this for you, have you guys seen some similar growth and impression growth on your end as well?
We have. I'm not too sure if we told the audience about everything, but we had Milestone implement schema on our website, westlakedermatology.com. I think it was implemented maybe 2 weeks ago, two Fridays ago. And since then, we've seen around a 14 to 15% increase in organic traffic. And I'm in control of the website. I live and breathe, and I have nightmares about the website sometimes. So nothing happens on the website without me knowing. Like nobody will even put a period on the website without me knowing. And we actually haven't done anything else. I mean, we've added a few blog posts and made a few small adjustments to the site, but nothing other than that. So really, I can say I can directly attribute that increase to the work we've done. Yeah, I'm excited for it to keep going. I see a little snippet right there of a zero place search result right there for our melanoma page. So I guess that's the proof right there.
All right, excellent. We are super to basically talk, as you're in crisis phase and digital marketers, you're trying to figure out one of the things that which basically maps into Eric's data as well as make sure that you are use this time to mark up some of the valuable content on your site with schema. It'll definitely go a long way as a part of health of your website is concerned, right? I want to go through a couple of these quickly, and then I want to give more time for questions. We have, I guess, another 15 minutes left. Email marketing, again, HubSpot basically measured the email performance during crisis, and they have said that open rate because more people are spending time online. That is definitely less about buying, more about caring. More show positive messaging in your emails, and of course, if your business is operating in new normal, if you are moving over to teledoc or telehealth, definitely communicate this message to your people. Of course, Adam, what is your experience with email?
Yeah, it's right along some of those parameters. We definitely always believe on keeping it targeted in terms of messaging. And highly segmenting everything. So we have obviously our list is segmented by like location, whether or not they are more medically focused or more cosmetically focused. And a good example will be next week is when we're opening up just for medical appointments. So we're obviously not going to email people who come to us for cosmetic reasons. For medical reasons, our cosmetics is going to open in 2 weeks, so we'll segment the list and do some emails first to our medical side, let them know we're open and taking appointments, and then later to the cosmetic side. And we also really don't believe in inundating people's inboxes. We usually try to keep it to at most a couple of months. Really just kind of just doing them. And having it being targeted and like you said, short and crisp, using it as a tool to push towards our website or push towards reaching out to us via phone, text, email, or booking an appointment right away. So cool.
And I think another interesting channel, of course, is going to be social channels. There are more folks spending time, and I have given some examples of blogs and social channels. Adam touched base upon this, and again, people are spending more time on social channels. Definitely do spend some time blog posts. Make sure that you are communicating clearly with your folks that whether it be you are operating in new normal or you are basically going to be sheltered in until the crisis gets over. Do definitely reach out to your customers. With that, I do want to hand it back to Eric.
Thanks, Satya. Thanks, Adam. That was a great discussion of the technical side and the practical side of what it's like to implement. Here are the takeaways and things we recommend you do in the crisis recovery and growth phases. So update your business listings, Google, Apple, Yelp, and Bing, and the verticals. Engage with your patients from what Adam said about the banner, what you do on the website, enhancing your FAQs, communicate with them via telemedicine if you've set that up, and email. Adapt to new behavior, online, mobile, and no touch. Figure out what people are using, and if you have a no touch solution or you want to talk about sanitation and to allay people's fears to help them make a decision to come in and see you and engage with you. leverage the COVID-19 schemas. I think everybody on the call is going to have some kind of information as we go through these next 2 phases to update your customers with. And get ready for the end of shelter at home. That means your service lines, what are you going to be offering? It might not be everything. Adam told me that they're opening most of their offices in Texas, but not all of them. You know, it's sort of dependent on where the virus was more or less under control. Think about your staffing. How many people are you going to need for, you know, if you have less people coming in, what the office is going to be like. Adam mentioned that they're, you know, what the PPE people are going to be using and that they're going to be doing temperature checks. All that has to be, that plan has to be developed, and then the marketing people help communicate that. And then plan to scale up marketing, plan to turn on your PPC, plan to turn on your display, and harvest what you've done in content marketing during these 2 phases. And importantly, and lastly, plan for additional restrictions to come back, just in case. There's definitely a potential story here for some type of shelter in place to return, and the marketing people should be as ready as anybody to have a couple options to roll out and put the market back in semi-shut down if that's what we get to. But we want to be ready for it next time. So as I said, I audited the websites of the people who registered for this webinar, and I've created reports for on these things, and I aggregated that data to make the benchmark research that I shared with you. If you would like a copy of your analysis, go to go.milestoneinternet.com/audit and sign up. I'll leave this up on the screen for another second or 2, and then when we go to questions, the URL will be on screen. And this will touch on the schema, the AMP, the mobile, the speed that I talked about in the research results. And you'll be able to benchmark your individual site performance versus the average of the industry. One of the things that was interesting is I threw in a lot of the largest and most famous hospital systems in the country, and their performance was actually below the midsize and the small in terms of using these technologies and in terms of mobile performance. So it was interesting to see. I know people at a lot of those hospitals, and I know they do a good job with SEO, and they have huge content bases, but their technical SEO has an opportunity in it. And if you're a small size and a medium sized provider competing against these large hospital systems, you can get an advantage by putting in place the kind of technical SEO we've talked about here today. All right, with that, we are going to go to questions, and this is the audit URL if you'd like to sign up and get a copy of your report. All right, Laura, back to you.
Great. Yes, thanks so much. Thanks for the insights. As Eric said, we're opening up for questions. We do have a few coming in right now, but please feel free to add any questions as we discuss the ones that are coming up. One that we have is on Google. Like with Google Post, how do you tackle this if you have multiple locations?
So right now, Adam, why don't you go ahead? You might have done this.
Yeah, so we have 15 locations, a disclaimer, so not a crazy amount, but still decent. And so what we try to do is obviously first and foremost make sure that any posts that we do applies to that location, because different locations have different offerings. And we try as much as possible to segment it, so that way if we know one location has patients who are more into this certain procedure, if it's say cosmetic, if we know people in Houston are more into these types of procedures, they'll get those type of posts. Whereas Austin, people are into a different sort of procedure, they'll get those types of posts. That being said, I still see value in reusing some of the same content as long as it applies to multiple different locations. So we're not afraid of using the same post for more than one location, but we do try to minimize that as much as possible. That's the basic answer.
So on the technical side, Google previously had restricted publishing Google posts through API. So if you are using one of the vendors for doing Google posts like Milestone, definitely the API now allows you to take a single post and publish it across multiple locations. So single content can be republished. But again, as Adam mentioned, it's very critical to have content relevance, whether that location, whenever you're doing a post, that location has the content that you're publishing is relevant to that.
And how long are Google posts visible?
I think right now Google previously said 15 days. We are seeing about 7 days, but they keep changing it. I don't know what the current visibility is. At least, what is your
I actually thought it was 30 days last time I looked, but I could be wrong as well. I do know it does vary. The more you post, you do bury older ones. So, you know, you kind of want to keep it fresh each month and sunset out old ones. So keep that in mind.
Yeah.
We usually have, I guess,
Right.
we usually, for instance, one of the 8 that we, or one of the 6 to 8 that we try to do each month is always like that month's specials. So we always will do that at the beginning of the month, and then at the end of the month, we'll sunset that out and put a new one for the next month.
So for other verticals, when we tried it out, we saw, at least during the crisis, we saw the lifetime increase by 15 days. But previously, before the crisis hit us, it was 7 days. But now it's around 15 days, and Adam's seeing 30 days.
Right. So how many frequently asked questions should someone develop?
So I guess as many would be the thing, but you need to answer as many relevant questions as possible, and that count more, of course, will definitely help you rank for more of these questions that your people are commonly asking you. And my recommendation would be you don't have, as long as you can develop the content and mark it up with schema, build as many questions that are relevant for you and as many long tail keywords that you want to rank for. What do you think, Adam?
I'll agree to that. I'll co-sign to that. I will just say we try not to double dip. So we try not to have too many crazy FAQ questions that are similar or about the same topic. We try to have like really distinct segmented FAQ questions, but we do usually have one per procedure or treatment. So we have quite a bit. And yeah, I'd say the more the merrier, as long as, again, you're not continually duplicating questions and answers.
Right. And a follow-up question is, should they put frequently asked questions on pages or in a database?
I mean, it should be outside. It should be out for Google to index it. I would definitely put it out on the pages and then put it out with markup, so that even if as your website traffic is increasing and if you're doing these best practices out in Google and you're driving your website traffic, I would definitely focus on putting it on the pages and marking it up. What do you think, Adam?
Yes.
And how many schema types should be on each page?
If I have to answer that question, so it will depend on the page first, but what we are seeing is somewhere north of 16 to 18 different schema types, at least bare minimum, on every single page. That basically identifies your brand, identifies your corporation, your entity, and what the web page is trying to convey. That's the bare minimum. And then on top of it, then you look at the content, and then for each and every type of content, each and every type of asset that is there on the page, you just start adding more and more schema types to mark up every single thing that's available.
Yeah, I'll say I have nothing to add to that because I'm not technical at all. We were, in your earlier poll, Eric, we were the group that had error schema. I believe ours was really old and errored out. And I kind of knew a little bit about it. Like I knew generally what we're trying to do with schema is trying to give Google enhanced background and information on a specific page. And I did a little bit of reading on it, but not technical at all. So I turned it over to Satya and Milestone to do everything. So yes, sounds great, Satya. I like your answer.
I believe we have one last one. Does on-page or tag injection make a difference for results?
Both practices are fine. On-page, basically, on-page putting the schema as a JSON-LD helps you. I mean, definitely it will cost more as the schema develops, and if you develop more and more content. On-page means you need to go and keep on updating your page. Tagging, you can keep the schema and content separated up, so you can actually load it. And as Adam mentioned, if any of your schemas start throwing errors because Google and schema.org, they change the requirements for the particular schema type, then you can actually quickly fix it without having to spend any time on development or basically updating your page. Both methods are fine. We use both these methods, and we have seen success with both of them.
Yeah, we do have actually another question. What tools do you use to develop schema?
So most of our tools are internal tools that we have developed. We have our own professional services team, which basically use our internal tools to audit the content on the site and develop and build a schema for that. It does require there are some of the tools we have. Our visual editors look at the page and then mark it up, and then look at all the requirements which are pulled from schema.org. There is quite a bit of automation that is built into it as well, into some of these internal tools that we use. Eventually, if there is enough interest, we will definitely open it up for the rest of the public to consume. But a lot of these tools are internal tools.
Wonderful. Well, great. I'd like to thank everybody and all our speakers for a great presentation. And please remember there's a brief survey following the conclusion. If you have any questions anymore, then please feel free to contact myself or any of the presenters, and we'll help you in any way that we can. Everyone have a great afternoon, and thank you.
Bye-bye. Thank you.
Bye.